Hi guys, I am back with a new video. Today I am going to demonstrate parietal bone. It is 2 in number and it is the bone of the head, and morphologically it is a flat bone. It consists of the outer and inner table, and in between them there is diploid, which is the cancellous bone, and outer and inner table is the compact bone. So it is a flat bone, and it was the formation of the parietal bone, and it is the exception. Mainly flat bone consists of the outer compact bone and inner spongy bone. So this one is the parietal bone, and I am going to say the anatomical points of this bone. This is the parietal bone of the left side, and antero-inferior angle is the most prominent, and which is directed forward and downwards, and external surface is convex and directed outwards. So I am going to say the parts of this bone. There are altogether 4 borders. This one is the superior border, this is the anterior border, and this is the posterior border, and this one is the inferior border. Superior border is also called the sagittal border, anterior border is also called the frontal border, and inferior border is also called the squamous border, and last one, this is posterior border, which is also called the occipital border. And there are 2 surfaces. This one is the external surface and this one is the internal surface. External surface, you can see it is a smooth and convex and directed outwards, and this internal surface, this is rough. Now in the external surface you can see a elevated portion which is called the parietal tuber or parietal tuberosity, which is clinically important. It is an important anatomical bony landmark, and for this bone, ossification starts from this portion, or from parietal tuber ossification starts. So this one is the clinically important area. Then there are 2 lines. This one is the superior temporal line and this is the inferior temporal line. And now I am going to say the attachments of the superior temporal line and inferior temporal line. Superior temporal line consists of the temporal fascia, and in the inferior temporal line there is temporalis muscle. And then there are 4 angles. This one is the antero-superior angle, and this one is the antero-inferior angle, and this is the posterior-superior angle, and this is the posterior-inferior angle. And these angles have another names too. So antero-superior angle is also called the frontal angle, and posterior-superior angle, it is also called the occipital angle. So antero-inferior angle is also called the sphenoid angle, and posterior-inferior angle, it is also called the mastoid angle. So these were the 4 angles, and now I am going to say the features of the inner surface of this bone. So inner surface consists of the impression for cerebrae gyri, and there are sagittal sulcus. So and this one is the middle meningeal vessels, and this one is the impression for the middle meningeal vessels, and it has 2 branches. This one is the posterior branch and this one is the anterior branch. So these are the anterior and posterior branches of the middle meningeal vessels. In the inner surface there is a parietal foramen which is situated posteriorly near the superior border, and this one is the parietal foramen, which consists of the superior sagittal sinus. This is a vein, and there is also the branch of the occipital artery in this parietal foramen. So in the antero-superior angle there is bregma, it is the meeting point of the frontal and coronal suture, and in the posterior-superior angle there is lambda, and in the antero-inferior angle there is terion, and in the posterior-inferior angle there is asterion. And terion is the important bony landmark. Lambda is the meeting point of sagittal and rhomboid sutures, and terion is the meeting point of the frontal bone, parietal bone, temporal bone, and sphenoid bone, and it is the important bony landmark. And this asterion is the meeting point of frontal, occipital, and temporal bones. In the anterosuperior angle there is bregma, which is the meeting point of coronal and frontal sutures, and in the posterior-superior angle there is lambda, and which is the meeting point of sagittal and lambdoid sutures. And in the antero-inferior angle there is terion, and posterior-inferior angle contains asterion. Anterion is the important bony landmark, and it contains anterior branch of the middle meningeal vessels, and it also contains Broca's motor area, which helps in the speech production. Terion is the meeting point of the frontal bone, parietal bone, temporal bone, and sphenoid bone, and asterion is the meeting point of the parietal bone, occipital bone, and mastoid bone. Now there are some joint and articulations which is related to the parietal bone. This anterior border articulates with the anterior border of the parietal bone articulates with the frontal bone, and it forms coronal suture, which is the suture type of fibrous joint, right? And then this one is the superior border, and it articulates with the another parietal bone, because you know that parietal bone is 2 in number, so it articulates with the another parietal bone, and it forms sagittal suture. Inferior border articulates with the sphenoid, and then squamous temporal, and then mastoid temporal. So three articulations are present in the inferior border. Now I am going to discuss about the frontalis. Frontalis are the membranous and non-ossified gaps present in the bones of the skull in the newborn or infants. There are altogether 6 frontalis, and among them anterior and posterior frontalis, they are the median one. There are 2 lateral pairs of the frontalis, they are the sphenoid and mastoid frontalis. So anterior frontalis is the largest frontalis, and sphenoid and mastoid frontalis, they are the smallest frontalis. Now I am going to say the closures of these frontalis. Anterior frontalis closes in the 18 months, and other frontalis normally closes between the 2 to 3 months. So that's it for today. Thank you guys for watching my video till the end. Hope you guys liked my video. Thank you everyone.